welcome you for coming. Let me take the opportunity to thank all of the press for showing up today. We want to take this opportunity to give the citizens of Memphis an update on the coronavirus or COVID-19 here in Shelby County. But first, I would like to thank our director of the health department with Shelby County government, who is doing an excellent job of taking care of the citizens of Shelby County as we deal with one case of the coronavirus here in Shelby County. Dr. Householder is going to come forward after I finish speaking. She's going to give you an update on the coronavirus as it relates to Shelby County. I'm Brenda Jones. I'm the Director of Emergency Management and Homeland Security for Shelby County Government. My office will definitely support Dr. Householder and her office with whatever needs for the citizens of Shelby County as we address the coronavirus here in this county. We will provide support, and of course any resources that are needed. We can provide resources from the state or the federal government, so we're here to support the Shelby County Sheriff's Department. Again, I can't thank Dr. Householder enough for all that she's doing to protect the lives and the property of the citizens, of the citizens of Shelby County. Now, Dr. Householder.
Thank you. Good afternoon, everyone. And I also want to echo Director Jones' sentiments and thank you all for coming out. As we indicated last week, we'll have a regular update every Wednesday at 2:30. If there's a change in status in between, we'll do a press conference in between. I also want to take a moment to thank our team members. We have 2 that are up here and several that are in the audience who have really worked tirelessly since, really for several weeks, but since Saturday and Sunday of this past week to identify all the contacts that have been in contact with the case that we referenced on Sunday, and to assure that those individuals are monitored and that they're not, if they become ill, that they get treatment immediately. So I appreciate that. We also have some colleagues here. Shelby County Schools is also going to give an update from the school perspective, and we also have representatives from Baptist here as well. So I secondly want to thank all of our community partners. The outpour from the community has been significant. It has been really for months, but the last week particularly, we've had everything from businesses reach out, the faith community, and individuals to determine what they can do to make sure that we keep Shelby County as safe as possible and reduce the transmission of COVID-19 here. Many of you probably know that the World Health Organization has declared COVID-19 a pandemic at this point. That is significant because that means there's significant transmission worldwide. We know that in the United States there are now over 1,000 cases, and within Tennessee there are 7, with 6 of those clustered in the Middle Tennessee region, and we still only have 1 case here in Shelby County. As I noted previously, that there were phases to an outbreak and management of an outbreak, and the first phase is containment, and that's where there's a desire to prevent the virus from entering the community. And then another component of that is early identification of cases and contact tracing. So that's where we've spent significant effort, is to make sure that cases are identified, and at this point there's 1, and all of the contacts are identified and quarantined or placed on monitoring of some sort. We will continue to be in containment phase if we receive additional cases or notice of additional cases, and at some point we may move into mitigation, which is broader community strategies. The key things that I think are most important today is that when we know that there's increased transmission either worldwide or in this case Middle Tennessee, we have to have heightened awareness. So some of the recommendations that I'm going to make are similar to what I've made before, but I'm going to make them with a much stronger recommendation. It's really critical at this point that organizations look at their continuity of operations plans and determine how they would operate if they had a significant number of team members who were out. That they look at their sick leave policies to be able to support individuals to stay at home if they are ill, and to create an environment where people do not come to work coughing and running a fever, so that if people are sick, then they're not able to spread it within the work environment. For individuals, it's critical now that they begin to look very closely at travel and make prudent decisions to avoid places where there's active transmission of disease. People who have chronic illnesses or are seniors need to be particularly aware of travel and make decisions about whether they want a social distance, which may mean avoiding large crowds potentially. And I've stated before, and I'll reiterate this, the importance of hand washing frequently with soap and water for at least 20 seconds, avoiding touching one's face, and clearly staying home if you're sick with any respiratory symptoms or running a fever. And people should be fever-free without any medication for at least 24 hours before they go back into public places. The other thing that's happened this past week is more and more people are presenting to the doctor's offices and emergency rooms wanting to be tested. I want to reinforce to people, as if you had a typical flu or cold, you generally don't go to the doctor's office. So if you think that you are sick enough to need consult from your healthcare provider, please call first so that they can be prepared if they want you to come in and protect not only others in the waiting room, but also their staff. And if someone needs to go to the emergency room, it's critical to call the emergency room first so that they're also prepared. And if you call an ambulance, to also notify the ambulance to make sure that there's critical PPE available for the EMS staff as well. I wanted to end with some things that we have been doing over the past week in addition to the contact tracing. Our staff are spending a significant amount of time providing technical assistance to all variety of organizations, from businesses to other divisions, as well as the faith community. In addition to that, within Shelby County, our mayor has implemented changes in our HR policies to make sure that people can stay home if they're sick. All division directors and elected officials have met to talk about what they can do in their respective areas to reduce the likelihood of transmission, everything from cleaning to sick leave policies to assuring that staff have the resources they need if they're going to stay home. I will be working with Director Jones as well as the mayor's office to convene a smaller task force to make sure that we're addressing the social needs that family members may have if they're quarantined or isolated. And then Dr. Randolph and David Sweat have been working closely with the healthcare community, particularly the hospitals, and they'll be meeting with all the community-based clinics to assure that people who are uninsured have access to appropriate and adequate treatment. So with all that said, I really want to commend Shelby County as a larger community. The response has been significant, and I think with all of us pitching in and doing our part, we're going to reduce the impact of COVID-19 on our community. We rely very heavily on the media to get out timely and accurate messages, so we really appreciate you being here. And with that, I'm going to turn it over to my colleague, Superintendent Dr. Ray, to speak specifically about what Shelby County Schools is doing to protect not only children, but their families. Thank you.
Thank you, Dr. Householder. Good afternoon. First, let me start by saying Shelby County Schools is committed to transparency and will share constant updates with employees and families to ensure we have the facts. It's critical that we fight fear with facts and knowledge. In February, Shelby County Schools was one of the first districts in Tennessee, to share messages around the COVID-19 virus with our families and our parents. And of course, you guys know this is an unprecedented time. But we want our parents, teachers, students, and families armed with facts and knowledge. But we need the media to help us. We need the media not to stoke fear. We need the media to help us help our parents. It's critical because our students, they need us and they depend on us every single day. But we need you to partner with us in this effort. And with that being said, the health and safety of our students, their families, and staff members continue to be our highest priority. And we learned late late yesterday evening that Shelby County Schools employee that worked at Treadwell Elementary School and Middle School, who was in quarantine, has been cleared by Shelby County Health Department. Let me say that again. We learned late yesterday evening that employee that worked at Treadwell Elementary School and Middle School, who was in quarantine, has been cleared by Shelby County Health Department. We actually have a letter, okay? This employee has an official clearance letter to return to work. However, the district is allowing the individual to return after spring break to recover from this very traumatizing ordeal. Okay? Now, I'll now turn it back over to the Shelby County Health Department officials on the clearance and the timeline of the quarantine. In Shelby County Schools, we will continue to lead through the moment. Thank you.
I want to open it up to questions, but since I started, a lot more of our team members have come in. So those of you who have been working actively at the health department on COVID-19, raise your hands. Because I get to be the spokespersons, but they're really doing all the hard work, so I want to point that out.
Dr. Haushalter,
Yes,
there's
sir.
been a lot of talk. Other counties and states have released travel information about their patients in their respective counties. Just for people out there wondering why this patient in Shelby County, we don't know sex, where the travel, if you could just kind of explain that.
So it's a great question, and it's very timely, because if anyone has kept up with the media, particularly in the Nashville area, because we're frequently compared to Davidson County area, Commissioner Piercy has retracted and pulled back much of that information. So as a public health leader, the information that we generally share with the public is information that would affect change. So where a person travels, if it's one person that traveled, it's not as important. If we have 2 or 3, or we understand there's more cases associated with a particular community, we'll make the announcement then. But at the current time, we know one person traveled to one place, and we don't know of any other cases necessarily right now associated with that particular community. So there's not a need to release that. As far as gender and age, that also isn't making a difference in our local response. What people need to know is we have a case, that person traveled, contracted it elsewhere, and that we don't have community transmission. As the pandemic unfolds, if there's a need to release more information that's relevant and would affect more change at a community level, then I'll release it at that point.
How many people have been tested in Shelby County so far from Shelby County?
We don't have the exact number, and the reason that we don't is that early on, all of the tests had to go through the Centers for Disease Control, and they were approved there. The next layer was through the health department, but now there are some commercial labs and academic institutions that can run their own tests. So we don't have a full number of how many tests have been run.
Is there a range?
I don't have it off the top of my head now.
Is testing available today for people in Shelby County?
There's testing available today for people who need testing, and I think that's important, is that a person just can't show up because they want to be tested and get tested. There's key criteria that have been established by the Centers for Disease Control to be able to rule out other illnesses and to look at the signs and symptoms someone presents with. But if we need someone tested in Shelby County, we have been able to get them tested. We've not had a problem.
And that's at the state lab?
At the state lab, but also, as I said earlier, now some of the commercial labs are coming online.
So how many tests have been sent to the CDC?
I don't know off the top of my head.
How many tests have been sent to the state lab?
I don't have that number, but what you have to keep in mind is people are going to be tested that don't have COVID. So what's really critical for this conversation is we have had one test that was positive. Others that were sent were all negative, and or people may have tested positive for the flu. And I've reinforced, and I think it's important to reinforce again, we are still in flu season. We have both flu A and B circulating, so that we have a lot of illness that's related to the flu.
You had mentioned Davidson County. They have updated numbers on their website about how many people have been tested. Why doesn't Shelby County have that?
We don't, as I said earlier, we don't have full information because some of it is done at a commercial lab, so it wouldn't be necessarily accurate information, and I would have to look at the website if you're talking about the state health department website or Davidson County website. So I'll be happy afterwards if you tell me which one to look at it. I think the state lab has theirs posted because they actually run the test.
Dr. Householder, can you walk us through how the quarantine ended for the employee? On Monday, you said it was going to last 14 days. So what happened between then and now that gave you confidence to say we can do it?
So great question. So quarantine is 14 days, but it's 14 days from the last contact. So if you remember in some of the other meetings that I've had is I will say we have to identify when a person came in contact with the case. We have to identify if they're an actual contact or not, were they in close proximity long enough and so on, and what date they had contact. It's 14 days from that contact. So no one gets released early. The difference will be when they had last contact or exposure with the case.
So yesterday was the 14th day since
Correct.
that contact.
Correct.
So the
Dr.
one
Householder,
case that you've
um,
identified, are you confident that all of the contacts have been identified, all of the secondary contacts have been identified, and that particular case is contained?
I feel confident that we have an exhaustive list of contacts and that our staff have interviewed all of those individuals and determined what risk category they fit in and taken appropriate action to make sure that they're either self-monitoring or quarantined. Yes, ma'am.
Dr. Householder, can you tell us what day the Shelby County coronavirus patient began exhibiting symptoms?
No.
Can you tell us what time frame it was between exhibiting symptoms and the having the samples sent to Nashville?
No, because that's actually a question to the healthcare provider who saw that individual patient, not to me. Yes, ma'am.
So, in the press release that you sent out on March 8th, you referenced, or the department referenced, the Center for Disease Control and Prevention now recommends that older persons 16 over and those with underlying chronic health conditions should stay home as much as possible. What is that stands for Shelby County, and what is considered a large group of people in your opinion?
So another good question, and the CDC does recommend that seniors consider staying at home and those with underlying conditions. But the other thing that the CDC points out is that varies significantly by community. So it's really important that I continue to point out that we don't have community spread. If we reach a point of community spread, I'm going to be even stronger in the stance that people should stay home. So right now it's a personal judgment as whether someone who's older and or has a chronic illness wants to go out. They should not go on a cruise and probably shouldn't travel to Seattle. But if they're going to visit family and everyone's healthy, that's fine.
What about larger groups?
Large crowds, there's some variance on the numbers there. Some sites will tell you 250 is a large crowd. Others, it's 50. It really depends on how close you are to others and whether you can keep a 6-foot distance or not.
Doctor, can you tell us, are there any conversations taking place between the city, the county, the health department? We saw Coachella, St. Patrick's Day festivals being canceled to cancel the St. Patrick's Day festival in Memphis this weekend or Memphis in May?
So we are having conversations with the city as well as the hospitality industry and working with them to determine what's the right choice for Memphis and Shelby County. Right now, if we have events this weekend, we really don't have community transmission, so there's not a need to cancel, but we have to look out to what it might look like in May. And so that needs to be made ultimately by the elected officials with input and support from us. As needed, we can also seek additional guidance through the state health department, and we'll likely do that. And also we can seek assistance through the state to the CDC so that we make a good decision here in Shelby County.
But those conversations are happening.
Yes, they're happening. Yes, ma'am.
What are you telling schools who might be considering canceling classes or moving them online? What's your suggestion to them, like universities and stuff?
So for universities and academic institutions, our advice thus far has been to be prepared to do that. And in the event that we have community transmission, they're able to quickly go online from classroom. But at the current time, there's not a need to cancel classroom type settings.
Define community transmission.
Community transmission means that you don't know where you got it from. We can't connect it back to a case. We can't connect it back to travel. That there's really no linkage to an index case.
But if you don't know, if there's not sufficient testing and it's difficult to get tested, how would you know if there's community spread or not?
Well, that's actually a question that comes up a lot, and what we anticipate as more testing is available, that we will get more positive tests and we'll have to make decisions based on the results of those tests. One of the things I want to point out, because I know there's a lot of focus on testing, I want to reinforce that we have been able to access testing here in Shelby County without barriers, consistent with the national guidance on who should and shouldn't be tested. Just broad testing does not necessarily reduce or prevent transmission in a community. The most critical thing is whether or not people have signs and symptoms of illness. When people have a fever and people are coughing and sick, that is when they're most likely to spread illness. So we need to focus more on whether people are symptomatic with symptoms of a respiratory infection and try to make sure those people avoid public places.
How many people have been ordered or recommended to be on quarantine in Shelby County?
So the number is, and I'm going to say broadly quarantine, but there's several layers of self-monitoring, and that includes people who have traveled and come back, and the CDC has recommended self-monitoring somewhere around 80. I don't know the exact number, but approximate is about 80.
80.
Yeah.
80.
Yeah.
And what does the test actually entail? Is it like a throat swab? Is it
Nasal, pharyngeal, and throat.
Dr. Ray, a question we're passing along from a parent, and that is, who conducted the cleaning at Treadwell? Was it staff, cleaning crews, or did you hire a professional cleaning company?
Well, Shelby County Schools, we contract that service out, and I believe that was Aramark who did the cleaning.
Dr. Haushofer, you were talking about folks who are self-quarantine.
Self-monitoring.
Self-monitoring. How do you monitor the folks who are self-monitoring?
So we actually get a list through the state health department, and we have information on those individuals. They've mostly traveled abroad and returned. And then depending on what country they travel to, they'll be monitored, which is we check in with them. We can do that by phone, by text, even email, at certain intervals throughout the 14-day period. There are other individuals that have actually called us when they've come back from travel, and then they're added to the self-monitoring list.
What parameters would have to be met for a school closure? This is probably a question for Dr. Ray. And then would school closures be on a district level, or would they be school by school?
Well, great question. We will take all school matters under advisement of the health department. They're a partner with us, and we want to seek advice from the experts. And if it's a district-wide thing, of course, I'll consult with the health department to get advice. If it's school by school, same thing. I want to consult the experts. I don't want to make an isolated decision because at the end of the day, students' education is so important. And when you close a school, sometimes our students don't get a chance to eat. You know, breakfast and lunch, it's provided. And a day without education is a day that our students sometimes won't learn to read, won't learn to do some of the algebra and calculus. I can go on and on. So we don't make that decision in isolation. So we'll definitely consult the health professional experts to guide us on any school closures.
And Dr. Ray, speaking to that, do you guys have enough resources in place to feed children if you do have to close the school? Are those resources in place? Do you guys have a plan?
Great question. So we have assembled a team that's looking at all of that with different scenarios. So right now we are in the planning phases, and I'm hopeful that working with our Central Nutrition Center to devise a plan to ensure our students can eat.
And I'm going to wrap it up because we're actually at time.
The health department did not inform SDS. I'm not here, sorry.
That's okay. We're over time, so I'm going to go ahead and pause it here and wrap up. We're going to give an update every Wednesday at 2:30, and if there's some breaking news in between, we'll do a press release at that time. I just want to reinforce that we rely heavily on the media to get accurate and timely information out to the public, so we really appreciate you being here. And I want to end with what I started with. I really want to thank the community more broadly. People have stepped up to say, what is it we can do? What is it we can do in our homes? What is it we can do in our churches? What is it we can do in our businesses to make sure that we have a healthy community? So thank you, and I want to say thank you to our partners.
Will you be taking questions throughout the week from the media?
No. If there's something that changes, we will entertain it at that point if I do another press conference. But we really want to dedicate our efforts towards planning to make sure that if we had to close schools, if we have to close businesses, that we're prepared for that, and want to dedicate our limited resources there. for right now. Thank you.